The health insurance industry has somehow been getting even worse with the rise of something called a self-funded healthcare plan. A self-funded health plan is a type of employer-provided healthcare plan that essentially functions as a type of health insurance. The main difference being up until a much higher threshold, it is the company, it is your employer paying for whatever your medical expenses are. This results in a much less expensive premium for the employer. They're basically just paying for overhead and administration from the health insurance company at that point. So it's essentially just a scheme that allows the health insurance company to offload a lot of its actual healthcare payment costs onto the employer in exchange for a lower premium. More or less seems like, same old, basically would be the same result in the end. So what's the difference? What makes it actually worse for the employee? Well, there's two key things. One is that, remember what I said, there is still a smaller premium paid by the company. There's not no premium, and that is for the health insurance company to do all of the administration and overhead. So the health insurance company, not even the company you work for, are still the ones approving or denying your care, or approving what medications or treatments are actually considered necessary or approvable in your situation. The second thing is, because this isn't technically a typical health insurance plan, it's funded by the employer, it doesn't really rely on the premiums to pay for most of your medical expenses. These plans aren't subject to state regulation, they're only subject to federal regulation, which is not nearly as specific or stringent as most state regulations are. It gives the insurance company a lot more leeway in terms of what medications they're allowed to say are not necessary, what medications they can determine they don't want to partially cover, what procedures they're allowed to approve or deny. They can be a lot more loose and arbitrary with what criteria would make a procedure or a medication actually necessary to provide a patient. And the worst part is, because it's only subject to federal regulation and not the stricter state regulations that exist, in many cases they don't even have to tell the client, tell the recipient of the care, not the employer, that say they're changing what medications are covered or how much they cover certain medications or procedures, which has resulted in people who have reliably taken, say, certain prescriptions suddenly seeing a multiple hundreds of % increase in the cost of the prescription, and it immediately becomes unaffordable. People have already died because of this. People will continue to die because of this. People have already gone into significant debt because of this, and people will continue to go into significant debt because of this. And all that's just to say that is yet another clear example that we need a public healthcare system that is geared to treat everyone instead of locking life-saving and necessary medical assistance and prescriptions behind profit motive. Because every normal person already knows that our private healthcare system is completely broken and in no way, shape, or form actually serves the needs of the populace and the people who need it. And yet, it continues to get even worse. Insurance companies find new ways to make it worse, to gouge people even more for services and medications that they can't say no to. It's barbaric. We don't have to live like this. Greed is just allowed to rule the system. But we don't have to continue to let it. So with all that said, hi there, my name's Max Diaz. I'm running for U.S. Congress, South Carolina District 1. And if you really like what I'm saying and you like my priorities, please follow my social media accounts, check out my website, and if all my policies and things I have to say really resonate with you, it would be a huge help for anyone to, just get involved, spread the word, and support the campaign. Thank you.